So today we have our topic Subclavian Steal Syndrome. So in this topic, first we should know some anatomy about these arteries. So at first we have this aorta. From aorta we get brachiocephalic artery from the right side. So then this brachiocephalic artery, it further divides into right subclavian artery and right common carotid artery. But for the left side we do not have this brachiocephalic artery. For the left side we directly get our branches like left subclavian artery and left common carotid artery. The thing which we have to focus on now at this time are subclavian arteries. So we have this right subclavian artery and we have this left subclavian arteries, and from right subclavian artery we get our right vertebral artery, and from the left subclavian artery it gives the branch left vertebral artery. So what happens in subclavian steal syndrome? This is a simpler diagram. In subclavian steal syndrome, what happened that we have a stenosis in the subclavian artery. We can see in this picture that we have this left subclavian artery, and in this left subclavian artery we have this stenosis or narrowing. So because this part of the artery it is narrowed or it is stenosed, so less blood is flowing through this part of the artery, and we know that this left subclavian artery is giving the branch of left vertebral artery. But because our left subclavian artery is stenosed, so not left vertebral artery is getting very less blood because of this stenosis. Our left vertebral artery is getting less blood, but in the right subclavian artery there is no stenosis, it's perfectly normal. So normal blood is flowing from this right vertebral artery. So blood flow in right vertebral artery is normal, but blood flow in left vertebral artery is very less because of this stenosis, right? So of course when there is low blood there is low pressure in our left vertebral artery, and we know that blood flows from the area of high pressure to the area of low pressure. So now because blood is flowing normally to the right vertebral artery, so here the blood pressure is normal, but because the left vertebral artery is not getting much blood, so here the blood pressure is much lower. So that is why blood starts moving from right vertebral artery to the left vertebral artery. So we can say that there is reversed blood flow in the ipsilateral vertebral artery, ipsilateral to the stenosis. And we know from these vertebral arteries blood is going towards the cerebrum or our brain. So because here is no blood flow or reduced blood flow, and this reduced perfusion would result symptoms of ischemia, pain or paresthesias in the arm of the site where there is stenosis. In this case, in this example, we have left subclavian stenosis, so our symptoms would occur in left arm. So in this diagram, simpler diagram, the same thing is that this is our subclavian artery and this is the stenosis and this is our vertebral artery, but because of stenosis not much blood is getting in this vertebral artery and there is reduced pressure, so that is why there is reverse blood flow and reverse blood flow in the ipsilateral artery and reduced blood flow to the cerebrum, which results in ischemia or paresthesias of the affected arm. So this reduced cerebral perfusion will cause ischemia, pain or paresthesias, right, in our arm. We also know that these vertebral arteries, they go into the brain, and with the basilar arteries they make vertebrobasilar. They are part of our brain's blood supply or the blood supply of the cerebrum. So when there is low perfusion, so of course there would be vertebrobasilar insufficiency, and which will result in vertigo and dizziness and etc. And of course because of stenosis, one arm is getting normal blood flow, but the arm with the stenotic vessel, it will be having decreased blood flow. So of course there would be difference of blood pressure in these two arms. So what we will find clinically, we will find blood pressure difference of greater than 15 millimeter in both the arms. The treatment of the subclavian steal syndrome. So if the patient is asymptomatic, we do not need any treatment, right? If patient is having different symptoms which we have discussed, so of course the patient would need treatment. First line treatment is endovascular treatment. In this treatment we would do transluminal angioplasty so that we will remove that stenosis, or we will dilate that stenosed part, and then we can use stunt as well. If this first endovascular treatment fails, then we have our surgical options. In this surgical options, we will make different pathway for our blood flow. So we can do carotid subclavian bypass graft, we can do subclavian carotid transposition, we can make axillary bypass, and these things. And we have also some medical management options, like we can use antiplatelets like aspirin and clopidogrel so that the thrombus is not formed at the site of stenosis. And we can also use statin so that there is no atherosclerosis formation at the stenotic vessel, which will further worsen the condition. So this was all about subclavian steal syndrome.